Preparing the dressings for Transverse Tibial Transport. These are the equipment that we need to use for dressings. 1K dressing pack, make sure it's well in date. Pair of sterile scissors. Packs of sterile non-woven gauze. Chlorhexidine 2% solution. If the patient's having reaction today, so had reaction in the past, we can use Prontosan solution as an alternative or normal saline. Let's proceed to unpacking this on a tray using ANTT approach. After washing your hands with soap and water thoroughly, so let's open this dressing pack. Again, check for the expiry date, so that's well in date. So opening the wound care dressing pack. And then just like this. Now you got the white sided, so at the tip of it, just pull that side, and this side, not touching the inside of the dressing pack, so as not to contaminate the sterility of it. And then what we can do is we can flip this dressing like so, in order for us to take this disposable bag, not touching the bottom part. Insert your hand in the hole, and then you can use that to arrange the items like so. Let's open some of the sterile gauze as well, because we really need this one. To that, let's open some. Let's open the sterile scissors as well, and then just drop it, and then let's use the Prontosan solution 2%. And that's everything that we need. So I'm just applying the sterile gloves at the moment. Then I'm going to show you how to prepare the gauze dressings that will replace the old ones. So take 3 pieces of gauze like this. Put them together, fold it once and again, so make it a nice thick square one, and cut halfway like this. Yeah, and then soak it in. Do 4 of these using 3 pieces of gauze. Fold it half and half again. Do the same as previously, and then soak. Let's do another 2 more. These gauze dressings will be going to the pin sites, and we'll keep it for a week. And last one. Once you've done 4, take it all off, make sure it's well soaked, and I want you to squeeze as much liquid, as much solution as possible, so that when we apply this, it's not going to be dripping, and it's not going to be too painful for the patient. At the same time, it doesn't irritate the patient's skin.
Stop.
Next step is for this one to remove the dressings. So it's not easy to remove the dressing. Just pull the dressings up and then keep the what we call the bongs or the metal clips up as well, not touching the wound. This is the figure of 8, so just unravel that. And same thing, take the dressing off on each one and have a look at the wound. And put that in the... So that's it. Right, now let's clean the pin sides. We clean each pin side, starting from the base, which is the skin, and then going up. You just gently clean the base with the skin, not having to irritate the skin area. Just do a bit of a 360 turn, and then pull the dressing up to clean the metal work, and then the base of the bone. You can do it repeatedly many times if you like. And then another clean piece of wet gauze soaked in chlorhexidine for the next pin. Do a 360 clean gently, and then pull it up, and then throw another one. .360 turn, and then up, and last one. And that's it for the cleaning. So now we're gonna put the dressing on with a split. Just need to apply the dressing like so, and then push the bone down like this, and then another one. Oop, I couldn't push the bone down. There you are, nice and firm there, and then the rest. I usually put the split facing down so that it's not gonna fall off, especially when iron starts. Okay, so I'm gonna put a figure of 8 type gauze using this one. So what I've done is just opened the whole base, and then I'll probably say make it 2 or 3, so I've done 3 this time, and then roll and get it wet, squeeze as much liquid as possible, and we'll use it for just securing the pin side. Figure of 8 fashion. And then insert that last bit underneath, and then push it down, and that's done.